How much walking helps? Somebody has asked the question, how much walking helps? Walking is an excellent exercise. Walking is actually exercise for the heart. It improves your muscle power. It improves your diabetes. It can bring down your cholesterol. It can bring down your weight. And it improves your mood. When you walk, a lot of hormones are secreted in the brain, which give you a sense of wellness and happiness. Please walk for 45 minutes daily. If you have knee pain, you can walk till you develop the knee pain, take rest, and you can split it for twice a day. Walking is a very, very important exercise which everybody should do it. Please do walk. In the COVID times, do not give a lame excuse, I cannot go and walk outside. We can even walk within a room. Or everybody has got a terrace. That's why I walk only in the terrace between 4 to 5 in the morning, not in the evening. So you can go there and walk in the morning. Please do walk. But one important thing for walking, you should buy a good pair of walking shoes. That's very, very important. Walking shoes you should buy.
When there is no joint pain, but the muscle surrounding pain, what could be the other causes?
One person has asked a very interesting question. I do not have joint pain, but I have muscle pain around the joint. This is what is called a soft tissue rheumatism. This is called soft tissue rheumatism. Invariably, it is due to mental tension. Soft tissue rheumatism. You have to see a rheumatologist, and if he excludes the possible of any muscle disease, then you have to get into yoga, pranayam, and a regular exercise program.
I have RH for 12 years, now taking methotrexate 15 days. Recently, I am having very frequent instances.
There is a patient with rheumatoid arthritis who has taken methotrexate for 15 years. Now, for the the recent past, is having multiple relapses of the arthritis. What to do? Methotrexate will act in about 70% of patients. Similarly, in 20% of patients, after some time, the response will go away, what we call as methotrexate failure. If that were to occur, then what you need to do is to consult your rheumatologist, and you have to change to some other medication. That the rheumatologist will do it. Just because you are unresponsive to methotrexate, it does not mean that there are no medications available. We have wonderful oral medications, and we have wonderful biologic drugs available in the Indian market today, biosimilars, which are quite economical, and it is actually very cost friendly. The cost benefit ratio of biosimilars is extremely good in India, and you can go in for biologics. It all depends upon your rheumatologist and your consultation with him.
Sir, could you please tell me vitamin B12, 1500 micrograms of paradox vitamin D will help in gout?
Somebody has asked me a question. I have gouty arthritis. Will supplemental vitamin B12 and vitamin D help? It's not going to help your gout. But I like to tell you one important thing. We have so much of sunlight in the world, so much of sunlight in this country. In India, it is summer, worst summer. Very few places have a bad winter. We all have significant amount of vitamin D deficiency because we don't go outside at all. Everybody with muscle pain, joint pain, etc. should get a blood vitamin D3 done. And if it is low, you should take supplemental vitamin D as told by the doctor. My mother suffering RA last 20 years, taking prednisolone 20 milligram per day. Very bad. Taking 20 milligrams of prednisolone for the last 20 years is absolutely bad. Absolutely bad. You have to go back to your rheumatologist, and he has to assess what amount of steroids are producing in the body, what are side effects have been done, reduce the steroids, and give them medications to cause steroid sparing, disease modifying drugs. My daughter taking steroid from January 21 for spondyloarthritis, good or bad or health. There is no indication for steroids in spondyloarthritis at all. Steroids are not given in spondyloarthritis. It is given only for a very short period of time if somebody develops eye involvement, what we call as uveitis. Do not take steroids for spondyloarthritis.
Which is the best biologic based on your opinions?
Somebody is asking me a very important question. Which is the best biologic based upon your experience? It is like asking a question. You see multiple women, just before you're married, you go and see A woman, B woman, C woman, 3 women. And you say, which is the best woman? It's like asking, what is the best wife in the world? Or which is the best husband in the world? The best husband should be handsome, should be humble. His purse should always be full. He should be very empathetic, loving. Take the cell phone anytime when you call. Okay. Or you take the best wife in the world. The best wife in the world should be absolutely beautiful, full of culture, carries herself, never gets angry, always caring, no mood changes. You are not able to get one husband or one wife with one good quality. How can you get a wife or a woman with all qualities? There is nothing called a best biologic in the world at all. Each biologic depends whether it suits the patient. So we prescribe a biologic depending upon the patient. And choosing the biologic is on scientific grounds, not on any other grounds of being emotionally attached to any biologic. We are not attached to any biologics emotionally. We have nothing to do. Fortunately, we do not have any emotional relationship with any molecule. It's no emotional. It's absolute science. We started depend upon experience. We can't start it. We continue. If they respond, it's fine. If they don't respond, we change to another molecule of a biologic. There is no best biologic in the world. Asking for the best biologic in the world is asking for the best husband or the best woman, which is in fact a mirage in the desert.
Difference between orthopedician and rheumatologist.
Very relevant question. At the end of the lecture, somebody is asking, what's the difference between an orthopedic surgeon and a rheumatologist? To be very frank, like the Buddha or Ramana Maharishi, I've been introspecting on this for a very long time. Invariably, people with joint pain go and see an orthopedic surgeon, or they go and see a neurologist thinking it is nerve pain. It is a myth. An orthopedic surgeon deals with trauma, joint replacement, spine problems, etc. A rheumatologist is never a surgeon. In fact, to be very frank, I don't know even how to cut vegetables. Even cutting nails is dangerous for me. We deal with the medical aspect of the joint, what we call as arthritis. So rheumatologists take care of arthritis. Orthopedic surgeons take care of trauma, joint replacement, joint surgeries. They are more surgeons than physicians, and rheumatologists are more physicians than surgeons. That's a very important one. And there's a very important myth which all of us have to dispense with life, that all rheumatological problems have their origin in the nervous system. The neurologist has nothing to do with the rheumatological problem at all, though some diseases can involve the nervous system. But a rheumatologist is a person one has to see for a consultation if anybody has got joint problems. I'm not canvassing for myself or anything, but common sense based on scientific evidence will say that people with joint pain and joint swelling who have arthritis should consult only a rheumatologist. They can consult their own general practitioner, or they can consult an MD physician also. And once they find that they require referral to a rheumatologist, they themselves will refer. Can you suggest best RA doctor in India? Silence is golden. I prefer to be silent. I'll never be able to give this answer. I am an RA patient, sir. Both legs TK are done, sir. I do regularly walking. I will continue. Excellent. Excellent, Sakti Rajeshwari. You have done a joint replacement. You are walking regularly. Next time you and I will participate in the Olympics. Sure. Are people with arthritis at greater risk to develop other diseases? What should a patient or caregiver watch for? Excellent. Rheumatoid, are people with arthritis because they do not walk much? If there's a family history of diabetes, they can develop diabetes. If they develop steroids, they can develop diabetes. The arthritis per se also can cause target organ involvement, like SLE can cause kidney involvement. SLE can cause involvement of the heart. SLE can cause involvement of the lungs. Rheumatoid arthritis can involve the lungs. It can also involve the heart. It can also cause ulcers in the skin which do not respond to treatment. The other diseases is very, very important. People with rheumatological diseases, especially rheumatoid and systemic lupus, they can greater incidence of developing ischemic heart disease. So that morbidity you'll have to watch for. So what we rheumatologists do is when we see a patient with a rheumatological problem, we see the patient holistically. We just don't keep looking at the tunnel vision. just at the joint and say, oh, you got only arthritis. I will not see your heart. I will not auscultate your lung. I will not take your blood pressure. Rheumatological diseases can affect multiple systems. That's very, very important. And a very, very good question given by a person as a caregiver, what I should give. As a caregiver, what is very important? Watch out for these problems. The other important point, be absolutely empathetic. The joy of living is in sharing. And sharing what? Empathy, love, unconditional love, concern. That's very, very important. What we call as tender loving care. Tender loving care is the best miracle drug available in the world. Be empathetic. Yeah.